Okay, so what we have here, we have synapses of aminoglycoside. Everything we need to know briefly about aminoglycoside. This one presented here, as you can see, number one, we are going to speak about how does aminoglycoside work. As you can see here, aminoglycoside bind to the 30S subunit ribosome. Aminoglycoside lead to the misreading of genetic code in the ribosome RNA. The end result will be inhibit protein synthesis, and the aminoglycoside considered bactericidal. If you compare that with the tetracycline considered like bacteriostatic. So we need to remember that aminoglycoside bactericidal medication, tetracycline bacteriostatic antibiotic. Moving a little bit more in details, aminoglycoside mainly cover aerobic gram-negative bacilli. So please remember the keyword here for us, aerobic, keyword for us, aerobic bacilli. Aerobic gram-negative bacilli. So that means aminoglycoside we cannot use aminoglycoside for anaerobic bacteria. So it's not for anaerobic bacteria. It's not like antibiotic, prefer antibiotic for positive gram negative, for example. Gram positive bacteria, it's not for that. So it's not for anaerobic, not for the gram positive. It's normally for the aerobic gram negative bacilli. Moving more, the aminoglycoside has a low volume of distribution. VD represent volume of distribution. That means the aminoglycoside will has limited access to the tissues and penetration, limited tissue penetration. So if you have infection inside the tissues and cells, it's very rare to use aminoglycoside because aminoglycoside will be unable to arrive to the tissues and cells with enough concentration to kill the bacteria. So in this case, keep this one in our mind. Okay, for the tissues and cells and organ, it's not popular in a clinical use to use aminoglycoside. Okay, uses here, we use aminoglycoside for patients of from urinary tract infection. And if you remember, this group of medication mainly it maybe cover the gram negative bacilli, which they consider like the main cause of urinary tract infection. This medication, aminoglycoside, and the significant one, streptomycin, used for treatment of tuberculosis. Okay, we use it for the bacterial endocarditis and normally use it with a combination therapy. It's not alone, with a group of medication from other mechanism of action or with other mechanism of action. We use it for sepsis and bacteremia, and you see here the infection will be in the blood and the fluid, and the aminoglycoside will be remain in the blood and the fluid, therefore considered like one of the most important medication for sepsis and bacteremia. We need to keep in mind that we have this very important side effect related to the aminoglycoside, ototoxicity and nephrotoxicity, and this one very important for us when you prescribe it to the elderly, for example, who suffer from renal impairment, or for small children may cause ototoxicity, and this will lead to the effect of the student, maybe the children development. Okay, we'll continue speaking about aminoglycoside synapses in brief summary to remember what is takeaway from this one. Takeaway point from aminoglycoside. Okay, first of all, we need to look on the aminoglycoside present concentration dependent killing. What that mean here when you increase concentration dependent killing, here we can type here like killing the bacteria, here the concentration of aminoglycoside. So when the concentration of aminoglycoside increased, the killing of the bacteria will increase. So what we have here, okay, this is the concentration here, and you can see here when the concentration of the aminoglycoside increase, the percentage of killing the bacteria will increase. As you can see here, we have a positive relationship. When the blood concentration of aminoglycoside increase, the killing of the bacteria will increase also. Okay. Moving to the next, post-antibiotic effect again. This important concept here with that when we talk about post-antibiotic effect. Example for that, aminoglycoside, for example, half-life. Aminoglycoside half-life, we talk about around 3 hours, for example, here. But the aminoglycoside, this half-life represent the concentration in the blood during the first half-life. They will drop to the 50% of the medication. However, the effect of this medication will remain to, for example, 8 to 12 hours. This is the duration of action or effect. And the reason for that, because this medication will leave the blood and go to the target. So this will affect the target, and this remain for that 8 to 12 hours. So in the plasma, half-life is short, 3 hours, but this medication remain on the target for 8 to 12 hours. This explains the mechanism of action, and that mean when we prescribe this medication will disappear from the blood, but this medication remain in the effect for 8 to 12 hours. Okay. So this aminoglycoside to consider like effective medication for gram-negative, for aerobic gram-negative bacteria, especially the bacilli. Limited effect on the gram-positive. Consider bactericidal, that means it kill the bacteria. Mainly prescribed intramuscular and intravenous, the most popular route of administration. Intramuscular and intravenous. We can prescribe it like locally as oral tablets for the GI system to prepare the colon for the colonoscopy. We have neomycin. So the only one here in the group, neomycin, to prescribe it orally. And again, when you prescribe neomycin orally, this is local effect. This prepare the colon for the colonoscopy. So the idea here is that neomycin will remain in the colon and excreted in the feces. Okay, continue speaking about the synapses of aminoglycoside. Aminoglycoside could be prescribed topically to the skin, to the nose, inside the ear, inside the eye. Could be like eye drops, or could be like a cream or ointment. So available eye drops, cream or ointment for the skin, nose, ear and eye. Okay, continue speaking about the aminoglycoside synapses here. Aminoglycoside poorly absorbed orally, so it's not popular use for the oral administration. We don't use aminoglycoside orally. For example, we don't have gentamicin tablet. This number one. Gentamicin arrive with a high concentration to the renal and high concentration to the inner ear. This explains the nephrotoxicity and ototoxicity. Here we talk about toxicity due to the high concentration in both organ, in the renotoxicity or nephrotoxicity and ototoxicity. So the reason we have high concentration of this medication, and because this medication arrives with a high concentration to the renal system, we can use it for patients from urinary tract infection, but not considered like first choice for the patient. Okay, so this medication considered like water soluble, therefore we don't prescribe it like orally because it's like will be unable to absorb from the GI system. And if you go back to the pharmacokinetic, we know that in order for any medication to be absorbed from the oral or GI system should be weak acid or weak alkaline and the third one should be lipid soluble. So for any medication to be absorbed from the GI system should be lipid soluble. As you can see here, aminoglycoside considered like water soluble. Therefore, we prescribe it aminoglycoside mainly intravenous and intramuscular. Okay, so again, aminoglycoside cannot cross blood-brain barrier. For this reason, we don't use it for patients from meningitis, for example. Is aminoglycoside not first choice for the patients from meningitis? For example, the drug of choice for patients from meningitis will be ceftriaxone, and this belongs to the third generation cephalosporin. Okay, so this medication will be excreted in urine, an unchanged situation. Therefore, we use it for the patients from urinary tract infection. We need to adjust the dose in patients with renal impairment. This medication group of medication has narrow therapeutic index. That means the toxic effect very close to the therapeutic effect. Any change in the concentration will lead to the toxic effect or to the subtherapeutic effect or no effect. I covered this narrow therapeutic effect some another slide in details. I refer you to watch that video. And cannot absorb orally. You can see it here. Poorly absorbed, cannot absorb orally. It's like repeated information for us. Now speaking about some more detail about aminoglycoside. As you can see, we already covered in a previous slide that the aminoglycoside considered the mainstay of treatment for the serious infection due to the aerobic gram-negative bacilli. For example, Klebsiella, Pseudomonas, we use aminoglycoside. We need to take toxicity in consideration. For example, this medication may cause ototoxicity or nephrotoxicity. What we have there is like, for this reason here, due to that toxicity, aminoglycoside is not considered first choice. We have some alternative option. For example, we can use third generation cephalosporin as alternative option. We can use fluoroquinolones as alternative option. We can use imipenem, cilastatin as alternative option. Another important issue here, aminoglycoside effectively targets susceptible gram-negative organism by diffusing through the porine channels in their outer membrane. So when you speak about the mechanism of action regarding the aminoglycoside, we have the bacterial here, then we have the RNA ribosome, nucleotide aminoglycoside. So what we have here, we have the RNA here. When you prescribe aminoglycoside should enter the cells. So aminoglycoside should enter the cells. Here, aminoglycoside need to enter the cells, and this will be through the some maybe porine channels here that allow the aminoglycoside to enter the cells. Some bacteria, if we have some bacteria, does not have this porine channels. For example, here, if you don't have porine channels, and in this case the aminoglycoside will be unable to cross the membrane, and this bacteria considered like resist the effect of aminoglycoside. Okay, so regarding mechanism of action of aminoglycoside, as you can see here, the aminoglycoside need to transport across cell membrane through the porins, and during this cross, aminoglycosides need oxygen for transport. So if, for example, when you talk about aerobic bacteria, that means the bacteria use and consume oxygen and depends on the oxygen. For this reason here, aminoglycoside considered active against aerobic gram-negative bacteria. If we have anaerobic bacteria, so we consider aminoglycoside ineffective medication for anaerobic gram bacteria or gram-negative, gram-positive bacteria. So anaerobic is not sensitive to the aminoglycoside. The bacteria should be aerobic bacteria because we need oxygen for the penetration of aminoglycoside inside the cell. This is number one. Number two, when the aminoglycoside enter the cell, it binds to the ribosome 30S subunit. and this will lead to the disrupt the genetic code. This will lead to the misreading of the RNA messenger, and at the end will lead to the inhibit protein synthesis. So this is the step for the mechanism of action for aminoglycoside. Number one, crossing the cell membrane depending on the oxygen transport. Number two, binding to the 30S subunit. Number three, disrupt the genetic code. Number four, cause misreading for the genetic code, and this will end this will conclude with the protein synthesis inhibitor. Okay, continue speaking about mechanism of action. As you can see here, we have the messenger ribosome. We have the messenger ribosome, and we have the 30S subunit. And here we are talking about the protein synthesis from the RNA. This will lead to the protein synthesis. Okay. What happened next here when you prescribe aminoglycoside to the patient? And you can see here the aminoglycoside inhibit this ribosome by two mechanisms. Number one, I will repeat the mechanism. Aminoglycoside will bind to the 30S subunit. Number one. Number two will lead the disruption of the misread of RNA sequence, or misleading to the genetic code, and this will inhibit protein synthesis. Okay, this will explain the mechanism here. Aminoglycoside bind to the 30S subunit. This will lead to disrupt of ribosome's structure, misread of messenger RNA, disrupt and terminate protein synthesis. Okay, speaking about the spectrum of aminoglycoside, first of all, we need to remember that aminoglycoside considered like bactericidal, number one, effective at killing bacteria. So aminoglycoside killing the bacteria. If you go back to the tetracycline inhibit the bacterial growth. The tetracycline target the organism primarily aerobic gram-negative bacteria, especially speaking about Pseudomonas klebsiella, for example. Only effective against aerobic bacteria. If we have anaerobic bacteria, it's considered like ineffective. We can use aminoglycoside as a combination therapy. For example, we can use it with the beta-lactam and vancomycin. And someone may ask why we use this combination treatment. Okay, here in this whiteboard, I would like to explain briefly what happened when you use aminoglycoside alone. Sometimes the bacteria develop the resistance towards the aminoglycoside and does not allow aminoglycoside to enter the cell here. As you can see here, the bacteria does not allow aminoglycoside to enter the cell. So when you have this combination between aminoglycosides and beta-lactam, such as amoxicillin or ceftriaxone or other group of bacteria, you can see here amoxicillin causes disruption in the cell membrane and opening gap or pores in the cell membrane, and this will allow aminoglycoside to enter the cell and inhibit the protein synthesis or the inhibit messenger RNA. Okay, this slide here considered like one of the most important slide in aminoglycoside. Summarize all the information with the details, and this will be great for the clinical practice, for the clinical rotation, for healthcare provider, healthcare medical student. We have on the right side we have the aminoglycoside. If you go back a little bit, we have the aminoglycoside again. We have the aminoglycoside here. I need to change the color for this pen and go with the red. So we have aminoglycoside, streptomycin, gentamicin, tobramycin, amikacin, nitlamycin, neomycin. So we need to remember here, for us to remember, you can see here intramuscular IV, intramuscular IV, and we have neomycin oral. So the question, or topical, which of these aminoglycoside are applicable to prescribe to your patient orally? We have neomycin. What is the purpose of prescribing neomycin? As you can see here, we prescribe neomycin orally to prepare the colon for surgery and inhibit digestive flora. So this is a very important maybe topics related to the aminoglycoside. Which of the following aminoglycoside could be prescribed orally to prepare the colon for the surgery, for example? A neomycin. Neomycin, we have it like topical ointment or topical cream to apply to the skin, and normally coming with the polymyxin B. So we have neomycin and polymyxin B. Okay, here you can see from the Google Images here, this one from Google Images, as I mentioned there, I type there neomycin, polymyxin, and this combination between two medication, and you can see it here. We have it like, if you click on this one to see what we have there, neosporin. Neosporin, this is a type of medication, group of combination therapy. We have it like for the otic, for the ears, infection, neomycin, polymyxin as ear drops. We have it like ointment, eye ointment, polymyxin, neomycin, eye ointment. Scroll down to see if you have anything else for the skin, for example, here. Okay, if I click on this one here, neomycin, polymyxin, sulfate, bacitracin, zinc, ophthalmic ointment, ophthalmic use. Okay, we have neomycin in the market as skin. If you click on the first one here, neosporin. Okay, we have neosporin ointment. So you can see it here like available like neosporin ointment, Johnson & Johnson. So this one for the skin, apply to the skin. Okay, so we have several formulation. We have several formulation belong to the neomycin. So remember here we use it orally to prepare the colon for the surgery, to inhibit the flora, typically to the eye, ears, or the skin. We start with the second most popular one. So we discussed neomycin. Moving to the second popular one, this is number one. We discussed this one. The second one, we have gentamicin. The popular medication could be prescribed intramuscular, IV. We have ointment, for example. And this, if you like to, if you are going to prescribe it, the injection should be 3 times daily. And the medication should be prescribed 3 to 5 milligram per kilogram gentamicin. The clinical use for gentamicin, speaking about gentamicin, number one, urinary tract infection. Number two, pneumonia, meningitis. Here we use it with a combination with the beta-lactam or with the third generation cephalosporin. Please remember that. We don't use it alone. So we use gentamicin with the third generation cephalosporin. A gram-positive infection with a specific type of gram-positive infection. The most important one, sepsis, peritonitis, important uses, topical application, for example, if the patient suffers from burns or wounds or ulcers. So we use gentamicin. The second one, the third one will be streptomycin. So the streptomycin here, if you go to the streptomycin, is very important. Here we have highlight tuberculosis. We use streptomycin for patients suffering from bacterial endocarditis, and we don't use it alone. We use it with the penicillin. Okay, tobramycin available as eye drops or eye ointment. Could be used for patients suffering from pneumonia, bacteremia, osteomyelitis. Okay, the third one here, number 4. Number 5, we have amikacin. Amikacin, we keep this medication for the serious infection of gram-negative bacilli. For the any infection resist gentamicin and tobramycin, this is the alternative. So when you start treat the patient, we start with the gentamicin. This is number 1. So start treating the patient with gentamicin. If there is no response, we move to the amikacin. It's not first choice. So if you a very expensive medication, prescribed 3 times daily, 50 milligram per kilogram, amikacin. Netlamycin is very similar to the gentamicin. So you can see here from the graph, from this chart here, we can ask the question, which of these medication, which of these aminoglycoside considered like popular use for tuberculosis? So we can go with the streptomycin. Which of these medication available like topical ointment to the eye, tobramycin, neomycin? Which of these medications should be kept for the serious infection that resist gentamicin and tobramycin? We have amikacin. So all these will maybe keyword for each medication: streptomycin, gentamicin, tobramycin, amikacin, and neomycin. Okay, we'll continue speaking about aminoglycoside. This slide here covers some maybe important aspect of pharmacokinetic regarding aminoglycoside. As you can see here, aminoglycoside normally administered like IV or IM, parenteral administration. All aminoglycoside should be administered IV or IM. We have one exception. We have neomycin. So all aminoglycosides should be prescribed parenterally. That could be intramuscular or could be intravenous here. Okay, so with the one exception here, we have neomycin, because neomycin carry the risk of severe nephrotoxicity. So if you like to remember neomycin, nephrotoxicity, both of them start with the N. So which of these aminoglycosides cause severe nephrotoxicity among the aminoglycoside? So we have neomycin. Neomycin is not administered parenterally. We don't have it. Could be orally or topically. We use it topically for the skin, ears, or eye, or could be orally to prepare the colon for the surgery. Moving to the adverse drug reaction regarding the aminoglycoside, as you can see here, three main adverse reaction: ototoxicity, nephrotoxicity, and neuromuscular blocking agent. NM stand for neuromuscular blocking effect. So for this reason here, it's very important to monitor treatment for for aminoglycoside, because aminoglycoside considered like narrow therapeutic drugs here. Any change in the concentration of the aminoglycoside will the patient suffer from toxicity, or any decrease will decrease effect of this medication. So for this reason, number one, we need to monitor the medication. So number two, we need to be monitor the patient for side effects, and one of these important side effects will be ototoxicity. Ototoxicity, aminoglycoside will be adversely affect the vestibular system and cochlear system. Vestibular system, if the aminoglycoside adversely affect the vestibular system, this will lead to the vertigo, dizziness, and losing of balance. And they said the most popular aminoglycoside will be streptomycin. So which of the most popular medication from aminoglycoside may cause damage to the vestibular and cause vertigo? The answer will be streptomycin, the most popular. Then we move to the cochlear apparatus or system. If this system damaged by the aminoglycoside, the result will be deafness. So if I clean this board for us, so what happened here? If we have cochlear damage, the result will be deafness, and this could be irreversible. So this is very important, especially when you prescribe it to the pregnant woman. That means you are going to have baby suffer from deafness, and this baby will lead to the mental retardation. Will suffer from mental retardation later on, because he will not be able to learn language, or like able to hear sounds, or any like verbal issues. Okay, so again, for ototoxicity, we have two types. We have deafness, or we have vertigo and balance disturbances. Regarding nephrotoxicity, we have, they said the aminoglycoside will be retained in the proximal tubules and disrupt calcium mediated transport system. So the aminoglycoside will be kept in the proximal tubules and disrupt this tubules. The aminoglycoside may cause kidney damage, and this kidney damage could be mild, reversible, and if you persist with the treatment, this will lead to the severe acute tubular necrosis and could be irreversible. So here we need to take something in consideration. When you treat your patient with aminoglycoside, treat the patient with the lowest effective dose. Very important, lowest effective dose. This is number one, and for short duration of action. two things to protect the patient from side effect. Number one, okay, low dose, low effective dose. Number two, short duration of action. Because if anything happened in the beginning, the side effect will be reversible. If you persist in the treatment, if you continue with the treatment, the adverse effect will become irreversible. The patient will suffer from chronic kidney disease, CKD. The patient suffer from permanent deafness, for example, irreversible permanent deafness. It's very important to take this in consideration. And the last one will be neuromuscular blocking effect. The situation here, they found that with the aminoglycoside may inhibit release of acetylcholine from the neuromuscular junction. Okay, this will conclude our session for today. Thank you for watching and have a great day, everyone.